student nurse today. I'm going to be assessing head to toe, and so I'm just going to assess from head to toe. Is that okay?
Yes.
And then if you could just tell me your name and date of birth.
Charlotte Cook, March 20th, 2006.
And can you tell me what year it is?
2025.
And can you tell me where we are?
Saginaw County, Michigan.
So you are ANO times 3, so I feel good about continuing. Now I'm just going to ask you some personal questions. This is a safe space, so don't be afraid to answer. I'm just going to start off with, are you allergic to anything?
No.
Do you have any past or previous medical history?
Exercise-induced asthma.
And do you go to a doctor for that or anything like that?
Yes.
Okay. And then do you have any family history?
My grandmother on my dad's side had COPD.
Okay. And none of your recent family members have it or anything like that?
No one directly related to it.
Okay. And then do you have you ever had any surgeries or anything like that done?
I got surgery on my arm when I was about 12, but it healed fine.
Okay. And then do you take any medications? That can be over-the-counter medications or herbal supplements.
I take albuterol for the asthma, minoxidil to get my hair to be thicker, and I take a multivitamin.
And do you have any signs or symptoms or any reactiveness to that or at all?
No, they work great.
Okay. And then for exercise, what do you do for exercise on a daily basis?
I walk about 30 minutes every single day.
Okay. So it's good for your exercise. And then for diet, what do you eat on a normal basis?
I really only drink water, and I eat 3 meals a day. I have a lot of fruit. When they have salmon at the dining hall, I always eat that, and I always get Caesar salad.
Okay, so you have fruit and vegetable intake, and you have good protein, so that's good. And then last but not least, do you smoke? That can be marijuana, that can be weed, that can be cigarettes, vaping.
Not anymore.
Okay. And so then I feel good about continuing. I am just going to start with vitals, so I'm just going to do a blood pressure. I'm just going to have you lift, or do you care what arm I use?
Nope.
Okay, so I'm just going to have you lift your sleeve up on your left arm then. And then do you have high or low blood pressure at all?
No, it's normal.
Okay. And then, so this might squeeze just a little bit and tighten, and then, so just be aware of that. And you can just relax your arm. I'm just going to pump it up to 140. So for your blood pressure was 118 over 60. And so that is close within normal range. It isn't too low, so that is good. And then now I'm just going to check your pulse. Okay, so for your pulse, I got 74, and for respirations, I got 19. So that is both within normal range, which is good, and I did that for a full minute. And then now I'm just going to check symmetry for your radial and your brachial. So your radial pulse is symmetrical. It is a good pulse, strong pulse, and good heart rate. Wow, good pulse rate. Now I'm just going to do your brachial. So your brachial is symmetrical. You have a good pulse rate. Your pulse is strong, so that is good. And then for pain, on a scale of 0 to 10, 0 being the least amount of pain, 10 being the most amount of pain, what would you rate your pain?
0.
Okay, so that is good. And then now I am just going to check your hands. Do you have any trouble with like breathing or anything like that on a regular basis? Okay. So I'm just gonna check for clubbing. And I'm not seeing any clubbing, and since we don't have a pulse ox and you are breathing well, I'm going to say that your oxygen is good and it is within the normal range of 95 to 100. And then now I'm just going to do capillary refill. So I just do your, and this is for perfusion. So your capillary refill was within the 3 seconds, which is good and normal, which means that your perfusion is good. And then I am also just going to now take your temperature. Is it right if I just touch your forehead?
Yes.
So before I do that, have you had any fevers recently, or have felt like hot or cold?
No.
Okay. So since we don't have a thermometer, I'm just going to assess on your head. And so I'm not feeling a fever, and since we don't have a thermometer, I'm going to say you're within the ranges of 97 or 98.6 to 99.6. Yeah. And so then I So now I'm just going to move on with the head to toe assessment. Is that okay?
Yes.
So I'm just going to start with inspecting your arms. So if you could just pull up your sleeves for me. So first off, your hands look symmetrical. I'm not seeing any lesions or bruising or anything like that, or any discoloration. And then your arms look symmetrical. I do notice you have a few freckles and a few moles, but they don't look discolored and they look symmetrical. For your arms, I'm not seeing any lesions or any bruising or any discoloration, so that is good. And then now I'm just going to assess for muscle tone. So this side. So your muscle tone is symmetrical. I'm not seeing any problems there. Your muscle tone seems good. Now I'm just going to do range of motion. So I'm just going to have you first off put your hands out like this. I'm just going to hold on to your wrist. I'm going to have you move them in a circle and then move them the other way. So I noticed there's a few crackles there. Is that normal?
Yes.
And was it painful at all or anything like that?
No.
Okay. And then now I'm just going to have you, I'm going to hold on to your elbow, and I'm just going to have you take your elbow, or take your arm and just go up and then go back down. So go ahead. And then I'm just going to do the other side. So I just heard crackles on your right arm. Is that normal?
Yeah.
And then was there any pain with both of them at all or anything like that?
No.
Okay. And then do you know how to swim?
Yes.
So I'm just going to have you do 2 forward strokes and then 2 backward strokes, and I'm just going to hold on to your shoulders. So I just noticed there was a few crackles there. Is that normal?
Yes.
And is it painful at all or anything like that?
No.
Okay. And then now I'm just going to do muscle strength. So I'm just going to have you stick your hands out like this. I'm just going to push outwards. I want you to push inwards. And then I want you to push outwards while I push inwards. Now I'm just going to have you put your hands like this. Push downwards while I push up. And then other way. Push up while I push down. And then I'm also just going to have you just squeeze my fingers for me. And then I am just going to have you take my hands. I'm going to have you try to pull me. And then try to not let me pull you. Okay? And so your muscle strength is good. I'm not seeing any abnormalities there. And then I'm just going to assess your cerebellar function. So I'm going to have you make an OK symbol. I'm going to have you touch your fingers and then go back. And then do that as fast as you can. Okay, your cerebellar function's good there. And then now I'm just going to have you take your hands. I'm going to have you flip them over and flip them back. I'm going to have you do that as fast as you can. And your cerebellar function looks good there. I'm not seeing any abnormalities. And then I'm just going to do one more cerebellar test. So I'm just going to have you touch your nose and then touch my pen light. Touch your nose, touch my pen light without moving your head. Touch your nose, touch my pen light, and then touch your nose. Okay, so your cerebellar function is good. I'm not seeing any abnormalities or anything like that. So that is good. Now I'm just going to move on with your head. And so then I am just going to inspect your head. So first, your part is symmetrical. Your face is also symmetrical. I'm not seeing any abnormalities there. And so I'm just going to first inspect your head and your hair. So I'm not seeing any lesions. I'm not seeing any bruising, any discoloration. I'm not seeing any moles or acne or any dandruff. So that is all good, and your part looks symmetrical, and it also doesn't have any discoloration. And then now I am just going to palpate your head, and so just let me know if there is any pain while I do this. Any pain there?
No pain.
Okay. And so then now I'm just going to move on to assessing your ears. So if you could just put your hair back for me. So your ears look symmetrical. I'm not seeing any abnormalities there. Just going to take a look at the inside of your ear. And then just the back side. Then I'm just going to move on to the other side. So I'm not seeing any infections. I'm not seeing any scarring. And I'm not seeing any redness. It's pink. I'm also not seeing any like lesions or bruising or any discoloration. So that is good. And then now I'm just going to do palpate your pinea. So just let me know if there's any pain. Any pain there?
No, ma'am.
Okay. And so then now I'm just going to move on to doing your nose. So I'm just gonna have you take your finger and cover one side of your nose, and then I'm just gonna have you breathe in and out. And then I'm just gonna have you do the same on the other side. Do you have any trouble with that or anything like that? Okay. And then I'm just gonna have you look up. Just gonna take a look inside. Okay. So your nose, the mucus inside of it looks good. I'm not seeing any redness or any infection. It's pink. I'm not seeing any discoloration, and I'm not seeing any polyps or any septum deviation. So that is good, and I can see that you're still breathing well. And then now I'm just going to move on to your eyes. So for your eyes, could you just close them for me for a second? So your eyelids look symmetrical, your eyes look symmetrical. You can open your eyes now. I'm not seeing any discoloration or anything with your eyelids or any abnormalities. I notice you, do you wear like certain type of like lashes?
Lash clusters.
Okay. And do you have like any infection with those or anything, any problem with those at all?
No, I don't have infection.
Okay. So that is good. And then now I'm just going to test your eyes. Are you sensitive to light or anything like that?
No.
Okay. So I'm just going to have you look straight at me, and I'm just going to shed a light in your eyes. And then I'm just going to do one side and the other. Okay, and then I'm just going to have you look at my pen light, and then look at my hand, then look at my pen light, and then look at my hand. So your eyes are symmetrical, equal, round, reactive to light, and accommodating. And your the round, equal, reactive, and that is Perla. That is cranial nerve number 3, because it is motor, which cranial nerve number 3 is going to be your ocular motor. And then that is good. Now I'm just going to have you take a look at your eyes again, but I'm just going to have you look up while I pull down, and then I'm just going to have you look down while I pull up. So look up and then look down. Okay. And so your sclera is white. It is not yellow, which means there's no jaundice, and it is not, actually no, it's pink. Hold on. Conjunctiva is going to be pink, and your sclera is going to be white. Sorry, I'm tired. So yeah, your sclera is white. I didn't see any yellow, so I didn't see any jaundice, and I didn't see any blue for any infection. And then for your conjunctiva is pink, so there's no redness, which means that there is no infection. And I didn't see any paleness, which means that you are not iron deficient, which is good. And so then now I'm just going to move on to cranial nerves. So cranial nerves number 1, 2, and 8 are sensory, and then cranial nerves number 5, 7, 9, and 10 are motor and sensory, and then the rest are going to be motor. So I'm just going to start with cranial nerve number 1, which is going to be olfactory is 3. No, olfactory is 1. Oculomotor is 3. Okay, those two I get mixed up. So I'm just going to be assessing for 1, which is going to be your olfactory. And so for that, I am just going to have you close your eyes for me, and then I'm just going to have you smell something for me and tell me what you are smelling. Go ahead and smell. And then you can open your eyes now and just tell me what you smelled.
Mentos.
Okay. So since I can see that you are smelling correctly and that you could smell that, I'm just going to say that cranial nerve number 1 is intact. Cranial nerve number 2, I would do if we had a Snellen chart, but since we don't, do you wear contacts or glasses?
No.
And do you see an eye doctor regularly?
Yes.
How often?
Like about once every 2 years.
Okay, so not bad. And since you go to a doctor, I'm going to say cranial nerve number 2 is intact, which is your optic. So then cranial nerve number 3 is going to be your ocular motor. And then cranial nerve number 4 is going to be your 3, 4, and 6. Yeah, 4 is going to be your trochlear, and then 6 is going to be your abducens. So for your ocular motor, I'm going to have your eyes are going to go inward and downward. For 4, for trochlear, your eyes are going to go lateral. And then for cranial nerve number 6, for abducens, that's just testing your motor nerves to see if your eyes can move like side to side and up and down. And so then I am just going to do that with the 6 cardinal fields of gaze. So I'm just going to have you just look at my pen light without moving your head, just follow my pen light. Okay, so your 6 cardinal fields of gaze are intact, and so since you could do 3, 4, and 6 cranial nerves, I'm going to say that those are also intact. For cranial nerve number 5, that is going to be your trigeminal. I'm going to have you close your eyes for me. I'm going to test your sensory. So I'm just going to touch your face with a Q-tip, and you just let me know where I'm touching.
Forehead. Right cheek. Chin. Nose. Left cheek.
Okay, so you can open your eyes. And then I'm also, for trigeminal, just going to have you open and close your mouth. And then I'm also just going to have you clench your jaw. So since you can do that and you can show that your sensory nerves are working and that you can move your jaw up and down and clench it, I'm going to say cranial nerve number 5 is intact. For cranial nerve number 7, I am just going to, that's facial, so I'm just going to have you make some expressions for me. So I'm going to have you puff out your cheeks. I'm going to have you smile. Can you frown? Can you make an angry face? And then can you raise your eyebrows? Okay, so since you can do all those facial expressions, I'm going to say cranial nerve number 7 is intact. For cranial nerve number 8, are you hearing well? Do you have any like ear infections or ever had any ear infections beforehand?
I hear fine and no infections.
So since you can hear me, I'm going to say that cranial nerve number 8, which is your auditory, is intact, and later we would do the Romberg, and so we'll come back to that later. And then so for cranial nerve number 9, 10, and 12, it's going to be with your mouth. So first of all, your lips are symmetrical. Your mouth is also symmetrical. I'm not seeing any discoloration in your lips, and your lips don't look chapped, which is good. And so then for cranial nerve number 9, 9 is going to be your glossopharyngeal, which, and then 10 is going to be your vagus, which for those two, I'm just going to have you stick out your tongue and say ah, and just watch for your uvula. And then for cranial nerve number 12, it's your hypoglossal. And so for that one, I'm just going to have you stick out your tongue and move it side to side. So if you could just stick out your tongue for me and say ah, then I'm also just going to look at the inside of your mouth. And then I'm just going to have you also stick out your tongue. Can you move it side to side? And then can you show me your gums? And then can you smile for me? So for the cranial nerves, 9 and 10, your uvula raised and your hard and soft palate looked good. I didn't see any abnormalities there. And then for cranial nerve number 12, since I saw you could move your tongue side to side, so and up and down, so those cranial nerves are intact. And then also inspecting your mouth, I didn't see any discoloration. I didn't see any lesions. I didn't see any redness for infection, and I also didn't see any tonsil stones, and so your inside of your mouth looked good. Your tongue was symmetrical. I didn't see any discoloration or any lesions or any abnormalities there. And then for your gums, I didn't see any bleeding or bruising or any redness or infection or discoloration. And then for your teeth were white. I didn't see any discoloration. I didn't see any chips or anything like that, so your teeth look good. And so then that's it for cranial nerves. So then, oh wait, no, there's one more. Cranial nerve number 11. So cranial nerve number 11 is going to be your accessory. So I'm just going to have you shrug your shoulders for me. So since you can shrug your shoulders and you can show me that you did that, I'm going to say cranial nerve number 11 is intact. And now your cranial nerves are all set. So now I'm just going to move on to your lymph nodes. So I'm just going to start with your occipital, and just let me know if there's any pain while doing this. So your occipital, and then your postauricular and preauricular. Any pain there?
No.
And your submandibular and your submental. Any pain there? And your cranial chain. Any pain there?
No.
And then I'm just going to have you shrug your shoulders forward. And then I'm just going to look at your supraclavicular. Any pain there?
No.
And I'm also just going to assess for turgor. So no tenting. And no tenting there, so you're not dehydrated. And then for your lymph nodes, since there was no pain, they also were not palpable, which is good. So now I'm just going to move on to your maxillary and your frontal sinus. And so just let me know if this is painful at all. This is going to be your frontal. Any pain there?
No.
And then this is going to be your maxillary sinus. Any pain there?
No.
Okay. And so that's good. And then now I'm just going to have you look up for me. So your trachea is in alignment, and I'm not seeing any discoloration. And I notice you have like a mole. Is that normal for you to have like
It's
moles?
always been
Okay.
there, yeah.
And I don't see any discoloration with that. I'm also not seeing any discoloration or any like bruising or anything like that with your trachea. So that is good, and you seem to be breathing still well. And so then now I'm just going to listen for bruise in your carotid artery. When I do this, I'm going to have you hold your breath, and then I'm going to let you take a break, and then I'll do the other side and I'll also have you hold your breath. So hold your breath. Okay, I'm not hearing any bruise or any whoosh noises there. And I'm just gonna do your other side, and go ahead and just hold your breath for me. And I'm not hearing any bruise or any whooshy noises there, so that is good. And then now I'm just going to just feel for your carotid pulse. So that was good. And I'm just gonna do the other side. Okay, so they're symmetrical, and your rhythm is good, and your pulse is strong, so there's no abnormalities there. And now I'm just going to take a look at my paper real quickly. I'm also just going to go back to the fact that when I did your eyes, your coronary light was good. It was symmetrical, and it was reactive to light, so that is good. And then now I'm just going to have you turn to the side. Is it okay if I just remove your entire gown?
Yeah, you're good.
So your back looks symmetrical, your spine looks in alignment. I'm noticing that you have some like acne and some moles. Is that normal?
Yes.
And your moles don't look discolored, they look symmetrical, so that's good. I'm not seeing any discoloration or any lesions or bruising or anything like that in your back. So that is good. And then now I'm just going to check your side. So you are a 2-to-1 ratio. You are breathing well, and your respirations look good there. And so a 2-to-1 ratio is good. Means that you're not a 1-to-1 ratio, which means that you don't have any signs of COPD or asthma, and you also don't have any barrel chesting. And then now I'm just going to take a look at your thyroid. So your neck is not discolored. I'm not seeing any like bruising or anything like that, so that's good. And then I'm just going to move your trachea to feel your thyroid, and then I'm just going to have you swallow. Okay, and then I'm just going to have you do it again. Okay, so your thyroid seemed good, it wasn't hard, and your trachea was movable, and was it painful at all or anything like that?
No, it was good.
Okay, so since it wasn't painful and I didn't see any discoloration, I also didn't see any hypo or hyperthyroidism, so that's good. But now I'm just going to move on to your lungs. And so then your trachea was, yeah, movable, but your thyroid was hard. No, not hard. Yeah, okay, so we're good there. So yeah, now I'm just going to move on to your lungs. So I'm just going to first listen to your lung sounds. So if you could, so I'm just gonna have to do this 12 times. I'm just gonna move your gown just a little bit. And then if you could just tell me if you need a break at any point in time, because I'm gonna have to do this 12 times. Just let me know by raising your hand. And then for when I do this and I move my stethoscope, that's when you can take another breath when I move my diaphragm. And actually, I forgot to do one thing, so I'm actually going to start over with that before I continue. And so before I have you do the breathing, I'm just going to find where your lungs end, just so I know where to stop. So I'm just going to have you take a breath and then just breathe one more time again. Okay, so your lungs end right there, and then now I'm just going to listen and just let me know if you need a break. And I'm right here. And one last time. I'm right here. Okay, so I didn't hear any whooshing noises or sorry, I didn't hear any wheezing or crackles in your lungs, so that is good. And then now I'm just going to percuss. And this time you can just breathe regularly. Okay, so I heard resonance, which is good. So there's no abnormalities there. And then now I'm just going to have you lie down for me. Then I'm just going to roll up your gown. And then can you just and then I'm just going to inspect. So I'm not seeing any any bruising, any lesions. I'm not seeing any discoloration or any discoloration or any like reaction to infection or anything like that. I do notice you have some lines here though. Is that just from like your bra and stuff like that, or like just more so your shirt?
Probably, yeah.
Okay.
It doesn't cause any pain. So.
It doesn't? Okay. And then I'm just going to look. Okay, and then I am just going to look down here. So I'm not seeing any abnormal movement there or any abnormal rising. So that is good. And then now I'm just going to move on to auscultation. I'm just going to start with GI. So I'm just going to listen for bowel sounds. So I'm going to start in your right lower quadrant. So I heard five sounds there. Now I'm just going to move up to your right upper quadrant. Okay, I heard five bowel sounds there. Now I'm just going to move over to your left upper quadrant. And I heard five bowel sounds there. Now I'm just going to move down to your left lower quadrant. And I heard five bowel sounds there. So you are, your bowel sounds are active times 4, which is good. And then now I'm just going to listen to your arteries for any bruise. So first, so NS-xiphoid process, and then your stomach meet in the middle. So this is going to be where your aorta is, and your aortic artery. And so now I am just going to listen. And I'm not hearing any bruise or any whooshing noises there, so that's good. And then now I'm just going to go to your left renal. Okay. Listen there. And I am not hearing any whooshy noises there, anything like that, or any bruise there. Now I'm just going to go to your right renal artery. And I'm not hearing any bruins there or any whooshy noises. And then now I'm just going to go down to your right iliac artery. And I'm not hearing any bruise there, any whooshy noises there. And then now I'm just going to listen to your left iliac artery. and I'm not hearing any bruise there or any whooshing noises. And then now I'm just going to percuss. Lower. Okay. So I heard timpani there, and all for quadrants of your belt. And then now I'm just going to do timpani up until I find the border of your liver. So right here is going to be the border of where your liver is, which is good. So there's no distension there. It's in the right placement. And then now I'm just going to do light palpation. And just let me know if there's any pain or anything like that. And I'm just going to be watching for any facial expressions. No pain. Okay, and I didn't notice any grimacing or any signs of pain in your facial expression, so that's good. And then now I'm just going to do the same thing with deep palpation, and you just let me know if there is any pain. Any pain there? No. And I didn't notice any grimacing or any facial reactions to notice or clarify that there's any pain. And so then now I'm just going to look at my paper one last time. And I am done.